Hello everybody, and welcome to Memesto Moment. I'm a registered nurse, and this is a show I talk about different topics in healthcare where we could utilize a tool that I invented. This tool is very simple, and I created it because of problems that I saw while I was working in the healthcare setting. Tonight what I want to talk about is incontinence. Incontinence is when someone goes to the bathroom on themselves and they need to be changed. Sometimes incontinence can happen periodically, or sometimes incontinence can be something that is how people live, and so every time they go, they have to be changed or cleaned up. So if you think about it, in every nursing home, in every hospital, in every healthcare setting across the world, there's several patients in that building or in that facility that need to have their diaper changed regularly throughout the day. When they're affected by things like dementia, Alzheimer's, confusion, stroke, traumatic brain injury, these sort of different things can alter their cognition and cause them to think when they're getting their diaper changed, to think that they're being sexually assaulted or raped, or maybe it's bringing back past memories, and they're not able to realize that in this situation that they need to have their diaper changed so that they don't have skin breakdown, so they don't get a UTI and have worse confusion. There's so many reasons why we can't just let someone sit in a dirty diaper, but people don't understand that. And we always say we have to live in their world. That's the number one thing to do when you're working with this population. And that's why I created this tool, is because we didn't have any tools that made that situation any better. So with this tool, we can utilize familiar messages or other methods, music, podcasts, other methods of audio and stimulation, to where we can live in their world, and we can get them to understand that we need to do incontinence care or a diaper change or whatever you would want to call it. But the fact of the matter is, we need to make this a pleasant outcome for the patient, and we have to make this a pleasant outcome for the staff so that the staff will continue to serve the patient how they need to. Now let's stop and think about this. If you work in healthcare, or even if you don't, you could realize that if someone was combative or fighting every time you had to change their diaper, that maybe they wouldn't get their diaper changed as much. Maybe because they're being combative, maybe they're being given Xanax or some sort of drug like that routinely throughout the day because they exhibit these behaviors. So we call these behaviors combativeness. What if this combativeness is just because they feel like they're being violated? These are just simple things that we could realize where we need to adapt to their setting, adapt to this individual. And our current situation with the workload that the nurses have, the nurse aides have, it's really difficult. And that's why this tool and this method was created, is because we need to make a situation where we can live in their world, get them to understand what we want them to do so that we can have benefits for them, benefits for the workers, and the best outcome that we need. Because in the end of the day, if we're giving someone an extra Ativan because we need to change their diaper, could we do something better? And I think we can, and our healthcare system has proven that we constantly improve things. And so I really want to ask you to participate in this weekly show that I do, and get involved in the different benefits that this tool has. I'm a working nurse who created this for people that I was taking care of. If you guys want to get involved, please send me a message or comment down below. I'll see you guys here next week, and I really appreciate your time.